Assalamu alaikum everyone. Thank you for joining MMAC's seminar on diabetes management in Ramadan. My name is Nabiha and I'm a third year medical student at the University of Ottawa, and I will be moderating today's session. Alhamdulillah, we are blessed to have three distinguished speakers with us here today. We will start off with Sheikh Ahmed Kuti, who will be sharing a tafsir of the verses pertaining to Ramadan and fasting. This will be followed by a short Q&A session where you can ask Sheikh Ahmed questions about the fiqh of fasting with diabetes. Next, we will have Dr. Tanzila Basreen, who will be explaining the medical aspect of managing diabetes in Ramadan. This will be followed by a talk by Nazima Qureshi, who will be sharing with us some dietary and nutritional advice for Iftar and Suhoor time. We will conclude the seminar with a Q&A session with Dr. Basreen and Sister Nazima. Just a disclaimer that we will try our best to get through as many questions as possible, but in the interest of time, we may not be able to cover all questions. Our first speaker, Sheikh Ahmed Kuti, graduated at the top of his class from Islamia College in Kerala and at the Islamic University of Medina with the first rank. He earned his master's from the University of Toronto and pursued doctoral studies at McGill University in Montreal. He served as the director of the Islamic Center of Toronto, the Islamic Foundation of Toronto, and has been a member of the Fiqh Council of North America. Currently, he is a resident scholar and senior lecturer at the Islamic Institute of Toronto. He has taught several courses covering all aspects of Islamic disciplines, and his fatwas have been translated into several languages. Without further ado, I'll pass it on to Sheikh Ahmed now.
Bismillahirrahmanirrahim. Alhamdulillahi Rabbil Alameen. Wassalatu wassalamu ala Sayyidil Anbiya wal Mursaleen. Muhammadin wa alihi wa sahbihi ajma'in. Rabbi shrah li sadri wa yassir li amri wa ahlul 'uqdatam min lisani yafqahu qawli. Brothers and sisters, it's my pleasure. It's an honor for me to be invited to share whatever knowledge I have with you. I pray to Allah subhanahu wa ta'ala to protect all of us from all of the deadly diseases. May Allah subhanahu wa ta'ala continue to shower His mercies on all of us, our children and grandchildren, and our kith and kin and family, and the whole community, inshallah. As Muslims, we should pray for everyone. And today, because of the limited time, although I'm supposed to be making a tafsir of the verses on Siyam, I have to limit myself to presenting some simple points, inshallah. I cannot go into a detailed elaboration or of the meaning of different issues of these verses. To begin with, these are the verses from Surah Al-Baqarah, verses 183 to 187. I will read them first, and I will cite the translation as translated by the study, the Quran, edited by Professor Hussein Nasr. When it comes to these kind of translations, because of the deep nuances of the Quranic language and the Arabic language, no single translation can do justice to the words and the phrases and the idiomatic expressions of the Quran. So keep that in mind. I may give you that translation first from the study, the Quran, and then I will explain, but while doing so, I will use my own words. Bismillahirrahmanirrahim. Ya ayyuhalladhina amanu kutiba alaykumus siyamu kama kutiba ala alladhina min qablikum la'allakum tattaqun. أياما معدودات فمن كان منكم مريضا أو على سفر فعدة من أيام أخرى وعلى الذين يطيقونه فدية طعام مسكين فمن تطوع خيرا فهو خير له وأن تصوموا خير لكم إن كنتم تعلمون شهر رمضان الذي أنزل فيه القرآن هدى للناس وبينات من الهدى والفرقان فمن شهد منكم الشهر فليصم ومن كان مريضا أو على سفر فعدة من أيام أخر يريد الله بكم اليسر ولا يريد بكم العسر ولتكملوا العدة ولتكبروا الله على ما هداكم ولعلكم تشكرون وإذا سألك عبادي عني فإني قريب أجيب دعوة الداعي إذا دعان فليستجيبوا لي وليؤمنوا بي لعلهم يرشدون أحل لكم ليلة الصيام الرفث إلى نسائكم هن لباس لكم وأنتم لباس لهن علم الله أنكم كنتم تختانون أنفسكم فتاب عليكم وعفى عنكم فلا نباشرهن وابتغوا ما كتب الله لكم وكلوا واشربوا حتى يتبين لكم الخيط الأبيض من الخيط الأسود من الفجر ثم أتموا الصيام إلى الليل ولا تباشروهن وأنتم معكفون في المساجد تلك حدود الله فلا تقربوها كذلك يبين الله آياته للناس لعلهم يتقون. Or you believe fasting is prescribed or ordained for you as it was prescribed for those before you, that happily you may be reverent. 4 days numbered, but if any one of you be ill or on a journey, it is a number of other days. And for those who can bear it, the ransom of feeding an indigent person. Whosoever volunteers good, that is better for him, and to fast is better for you if you but knew. The month of Ramadan is that wherein the Quran was sent down as guidance for mankind, to mankind, as clear proofs of guidance and as the criterion. Let him among you who is present fast during that month, and whosoever is ill or on a journey, it is a number of other days. God desires ease for you, and He does not desire hardship for you. It is so that you may complete the number and magnify God for having guided you, that happily you may give thanks. When my servants ask thee about me, truly I am near. I answer the call of the caller when he calls me. So let them respond to me and believe in me, that they may be led aright. You are permitted on the nights of the fast to go unto your wives. They are a garment for you, and you are a garment for them. God knew what you were betraying yourself, that you were betraying yourselves. So He relented unto you and pardoned you. So now lie with them and seek what God has prescribed for you, and eat and drink until the white thread and the black thread of the dawn become clear to you. Then complete the fast until nightfall, and do not lie with them while you are in retreat in the mosque. Those are the limits set by God, so approach them not. Thus does God make clear His signs to mankind, that happily they may be reverent. In these verses, Allah subhanahu wa ta'ala calls the believers, the word used is kutiba alaykum siyamu. This is kutiba, word kutiba means farala. It's a farl. It's decree, a firm decree from the Creator, the Lord of the worlds. Allah calls the believers who have accepted His sovereignty and lordship, and issues this firm decree that fasting has been ordained as it had been ordained on those before you. This should not be taken to mean that the form of fasting prescribed on Muslims is the same that was prescribed on the Christians or the Jews or other uh, religious communities. The spirit is the same, but the form has varied, changed. It is the same with Salah and Zakah and pilgrimage. All of these pillars are in every single religion. They are part of the perennial religion of Allah subhanahu wa ta'ala. But the forms have varied. The revelation in the month of Sha'ban, this revelation ordaining fasting, was revealed in the month of Sha'ban in the second year of Hijrah. When you look at the 5 pillars, of course, this Tawheed is the cornerstone. like when you build that tent, there is a central pole, that is Tawheed, Shahada. And then there are four pillars. So you have Salah, you have Zakah, you have Saum, and you have Hajj. Salah came first, followed, it was prescribed for all Muslims in Mecca itself. But when the Prophet migrated to Medina, the first institution, first pillar to be ordained, prescribed was Zakah. That was in the second year, and fasting follows, comes in the same year in the month of Sha'ban. And when it comes to Hajj, it's a contentious issue, but most of the eminent scholars prefer that it was prescribed in the 9th year of Hijrah. Some say it was on the 6th year, but Rasulullah sallallahu alaihi wasallam only performed one Hajj, and that happened in the 9th year. The word Ramadan comes from Ramad, which means burning. It was prescribed in the hot summer month. Some scholars say it has a symbolic meaning that even as Ramadan, the fasting melts our fat in the body, it melts our sins as well. This can be taken, as because all of these prescriptions of Islam, as Imam Ghazali has said, different layers, different dimensions. There is a physical dimension, there is a moral dimension, a social dimension, and a spiritual dimension. So, because multi-layered. And the next point that is raised in the ayahs, لَعَلَّكُمْ تَتَّقُونَ, so that you nurture taqwa. The word taqwa comes from wiqaya. Al-wiqaya khayrun min al-ilaj. Prevention is better than cure. It means protection, shield, prevention, etc. Various shades of meaning for this word. The Prophet ﷺ described fasting as sawmu junnah. Fast is a shield. How it becomes a shield? Because it develops self-restraint. You forego, restrain yourself and forego food and drink and gratification, sexual gratification from dawn to dusk. And you do it not one day or 2 days, for a number of days. Behavioral psychologists say it takes at least 21 days for a person to change, break a bad habit and develop a new habit. And look at the wisdom, the divine wisdom. Fasting is for one whole month. It could be 29 days or 30 days. So this is to entrench that training, because it takes repeated action day in and day out. So day in and day out, you are foregoing this and restraining yourself from gratifications. Fasting in Ramadan is obligatory on everyone who is healthy and free of certain specific conditions. Number one, health challenges, medical conditions. Of course, I will explain it a little bit. You have doctors and dietitians who may be telling you different aspects of how fasting impacts your health, influences it positively or negatively. Long journey, journey itself cannot be an excuse. Long journey involving hardship. And old age, feeble old age, when people become exhausted in that age, when they fast, of course, there's an exception. Pregnancy, women who are pregnant, menstruating, postnatal experience of bleeding, breastfeeding, these are conditions where they are excused from fasting, but they should make up for it later on. Those who skip should make up when they are able to do so. In the case of those who are unable to make up, which is the case with those who are terminally ill or in fragile old age, they should compensate, they should redeem themselves by offering Fidya. Fidya is compensatory, redemptive expiation. To some extent, it to those who are pregnant or breastfeeding. There are scholars, Ibn Abbas and others said, if in the case of a pregnant woman or breastfeeding mother, and they find it hard to make up, they can offer fidya. But later on, if they are able to make up for it, because they are past that age of pregnancy and breastfeeding, and the children are grown up now, and they can make up for it, and they should do so. Fidya, what is fidya? Now, fidya is, giving a mud. But of course, in our Canadian context, we can say it is the price of an wholesome meal. Of course, you cannot give someone, a packet of food, but you should provide for him the cash equivalent of at least $14 or $15, and that is the minimum now because the price is soaring up. A wholesome, decent meal. And of course, as Ibn Taymiyyah Rahimahullah said, a person who is is rich and he eats good meal, very expensive meal, he should do so. So he give more, and that's why giving more is encouraged in the case. But of course, those who cannot do so, they should give at least $14 or $15. Now, another point raised in these verses is Ramadan is the month in which the Quranic revelation began. The first revelation came to Rasulullah Sallallahu Alaihi Wasallam when he was meditating in the cave Hira. And so, to commemorate this event, this is the most wonderful, most precious gift that God has given humanity, and we are fasting, and one of the purposes to commemorate that event. And then Allah subhanahu wa ta'ala repeats the exceptions, some of the exceptions mentioned earlier. And then Allah reminds us of the mercy of divine laws. This is one thing for us to understand, that the whole of Sharia is a manifestation of the divine mercy. Because Allah subhanahu wa ta'ala revealed laws that are conducive for our welfare and well-being. But sometimes human beings, because they are prisoners of their subjectivity, they may not recognize what is good for them in the ultimate sense, because they are prisoners of the subjective mindset at the time. They miss that global view, the collective reasoning, collective the global view of things. So Sharia comes to help us, to restrain us, to curb our lust and protect us from our own weaknesses. So all of these institutions at the same time therefore have relaxations, because Allah does not want to bring hardship and make life difficult for us. But having said that, a simple difficulty or hardship should not be used as an excuse. Of course, there is a difficulty. It's difficult to wake up for Fajr when you are in deep sleep, but that's not an excuse. So you are talking about real hardship that prevents a person from functioning normally in his life, with his work and things like that. So al mashaqqa tajlibu taysir, where there is hardship, rigors of the law are relaxed. So it is in the spirit. And the next verse is talking about وَإِذَا سَأَلَكَ عِبَادِي أَنِّي فَإِنِّي قَرِيبٌ. When my servants ask you about me, tell them I am near. You may ask, what is the connection of this verse with the previous and the next one? There is a deep connection. If you really understand the Quran, we need to reflect deeply. The fasting, it is telling us, reminding us of the spiritual effects of fasting. It deepens our spiritual awareness. It helps us to see beyond the material surface, to see our real identity, because we are not just mold of clay, the physical body. We are created from that divine breath. And the fasting deepens our spiritual awareness. The Prophet ﷺ said, Alayka bis-sawm, be consistent with fast, because there is nothing like fasting. And that is why we are told that Prophet Musa and Isa alayhi salam, both of them fasted. before preparing themselves to meet the Lord, to commune with the Lord. We also learned that Prophet Muhammad sallallahu alaihi wasallam fasted while he was meditating in the cave Hira. And Allah says Allah is near. So even as these prophets commune with Allah subhanahu wa ta'ala in preparation for it, they fasted. We fast, and by doing so we can have a share of that divine gift, that we will become closer to Allah subhanahu wa ta'ala, and we are ready to communicate and commune with him. Now the question is, how does Allah answer our prayer? He gives what we ask for if we are ready for it. Otherwise, he answers through silence. When Allah does not answer, it is an answer in itself, because Allah has decided we are not ready to get that answer from Allah subhanahu wa ta'ala. Or by virtue of, because we are not ready, still our prayer is effective, benefits us, because by virtue of our prayer, Allah will avert calamities from us, and he keeps, otherwise he will keep that in store for us to present us with it in the next world. The next verse removes a misconception among the companions regarding spousal intimacy in Ramadan. So spousal intimacy is allowed during the nights. Some of the Sahaba used to think while fasting we cannot have anything, and therefore some of them could not control themselves and violated. Then Allah subhanahu wa ta'ala revealed that yes, you are allowed to have that sexual intimacy with your spouses during the night, but you should restrain yourself from the beginning of dawn until sunset. And it's also reminded it is a taboo to do so during i'tikaf. Now, when it comes to sickness, if sickness, many people think that this is a discussion that will come, dietitian will talk about it. I myself am diabetic, and my wife has been diabetic for years. We fast. Fasting does not have any adverse effect. It only makes our condition better. So having said that, I cannot impose this on anyone. They should ask their physician, their doctor. Sometimes your own experience will tell you, as soon as your sugar level drops, you should break that fast, because Allah does not want to impose hardship on us. The Sharia is all based on divine mercy and removing that hardship. So if sickness impairs the health or worsen the sickness, it is forbidden to fast. If it is hard and we cannot function, then it is recommended to break. Allah allows his servants to make use of his concessions. So having said that about diabetic, I know many people simply think because I am a diabetic, I shouldn't be fasting. It's wrong to make this conclusion. They should consult the doctor. They should look to their own experience, check their blood sugar levels, and then decide for themselves. Only if fasting has an adverse effect, then they should not be fasting. If fasting entails no adverse effect on sickness, then one should fast. And that's what Allah subhanahu wa ta'ala said, وَأَن تَصُومُوا خَيْرٌ لَكُمْ. Fasting is for your own benefit. Now a lot of studies have come out explaining the benefits of intermittent fasting. Remember, Rasulullah sallallahu alaihi wasallam recommended fasting on Mondays and Thursdays, 2 days a week. Today, the science has proven the effectiveness of such. Now, when it comes to journey itself, some also take it literally. They don't understand the purposes of the Sharia. Sharia is based on maqasid, ultimate wisdom and purposes. Lawgiver has purposes for this. And why in the journey we cannot fast? We are told excuse from fasting. It's because of journey itself. It's a punishment, a torture. But sometimes a person is traveling in the business class. What kind of hardship is going through? So one should consider this carefully. So you cannot say anyone traveling should make use of that. relaxation, concession. The purpose of relaxation is removal of hardship. If the fasting does not involve any hardship, one should keep it. If it is hard, then one should break it. The Prophet ﷺ, while journeying, sometimes he fasted, sometimes he did not. Having said that, when he saw some of his companions becoming exhausted and dehydrated, he said, "It is not virtuous to fast while traveling in such conditions." So again, the mercy of Allah subhanahu wa ta'ala. Since bringing ease and removal of hardship is integral to the divine laws, there are some other conditions which may call for relaxations. In this time and age, there are physicians, busy in the operating theater. And if they are going through this long day of fasting, it not only affects them and the work they are doing. In this case, they are excused from fasting. When they are out of that and they have time to make up, they should do so. The same way people working, manual labor work in the summer, dehydrating, causing dehydration, they should not be fasting, they should fast later on if the conditions change. So anybody in that, I would also recommend somebody who is a student giving a very, very important, the final examination. You may be taking a comprehensive examination, you cannot delay it. You're exhausted. Of course, in this case, they can also come in this category, inshallah. This is what I have to share with you, and then now I can, leave the room for questions, inshallah. Stop sharing.
Jazakallah khair, Sheikh Ahmed, for that enlightening talk. I'm sure we can all benefit from these gems as we prepare for Ramadan in the coming week. So we have a few questions for you. The first question is, how can I make the most out of Ramadan if I'm exempt from fasting?
Well, as Imam Shawaliullah Rahmahullah said, Ma la yudrak kulluhu la yutrak kulluhu. If you cannot do one thing with all of its conditions and requirements, that doesn't mean you give it up altogether. Ramadan has many, many aspects to it. One is the fasting, the other is Salatu Tarawih, reading of your, renewing your connection with Allah subhanahu wa ta'ala, establishing consistency in dhikr, and studying and reading the Quran. So all of these other things should be done, and lots of charitable works, financial charity as well as other charitable works that you are able to do. All of this will compensate, because Sharia of Allah subhanahu wa ta'ala is all based on mercy. If somebody cannot do one thing, Allah will compensate for him or her by doing whatever he or she can. This is a lesson Prophet taught the poor believers, who said, look at the rich people, they fast, they pray, they do everything. But on top of that, they give charity. Because we are poor, we cannot do that. So the Prophet ﷺ said, Allah has appointed for you other things that you can do. By doing them, you can be compensated for. So make lots of dhikr, tasbih, tahleel, and tahmid, and Allah, that will serve as charity. And the Prophet called them charity. If you guide someone who is misguided, that's an act of charity. If we teach someone a verse of the Quran, that's an act of charity. So good deeds are comprehensive, as wide as life itself. Any kind of beneficial service that you render to individuals or the community, that you will reap reward for it. So they can engage in those works, and thereby they can compensate for the deficiency of not fasting.
Jazakallah khair for that, Sheikh. We have one more question. Can I donate food instead of money for Fidya? And how much food can I donate for each day of fasting that I miss?
Well, if you have people that you can provide that food, you can buy a package from Paramount or wherever, a good wholesome meal, and provide it to that poor person to break the fast, inshallah. It all depends on your condition. If somebody is unemployed, if they cannot afford a very expensive meal, so whatever they can afford, they should give. Everyone's standard is different. As Ibn Taymiyyah Rahimahullah pointed out, this is the way to look at it. But a minimum is there, at least $14 is a minimum. But if somebody cannot afford that, he can even get, they can even give what they can afford, and Allah subhanahu wa ta'ala is merciful, inshallah.
Great. Thank you. Once again, Jazakallah khair, Sheikh, for speaking with us today. Those were all the questions that we had.
Okay, so if you excuse me, can I leave?
Of course. Assalamu alaikum. Thank you very much for your time.
Okay, Jazakumullahu khair. Assalamu alaikum.
Yeah. Our next speaker for the session is Dr. Tanzila Basreen. Dr. Basreen is a family and emergency physician in Ontario. Dr. Basreen's passions include medical education and leadership. Her community work spans from working with various NGOs to multiple medical organizations, including serving as a board member at the Muslim Medical Association of Canada and the co-founder of Women's Health Education Made Simple. Dr. Basreen, thank you so much for being with us this evening. Please feel free to start whenever you're ready.
Thank you for organizing this. I know Nabiha actually did a lot of work to put this together, so thank you, and thank you for having me. All right. Okay, so I'd like to start by saying a big thank you to some of the people who've worked really hard to make the Canadian guidelines on managing patients who fast with diabetes. So a lot of the things that I'm going to be talking to you about comes from research and evidence from Muslim countries as well as Canada. And so it's so important to realize that we have a big multidisciplinary approach into taking care of you when it comes to fasting and diabetes. So some of my contributors, Dr. Taisir Abu Hassan, one of the co-authors of the guidelines, as well as some dietitians and pharmacists from North York General Hospital. So why does this matter? And I know you're all here because it matters to you. But if I look at the 2011 statistics, we have a lot of Muslim patients with diabetes who will be fasting. This is, again, 10 years ago. These are the numbers, which must be way higher now. Almost 34,000 just in the Toronto area and about 84 or more. And between those 10 years, I'm sure we've had lots more people immigrating, converting, or whatnot, who are now Muslims. And so this is a very important topic. And it's impacting a lot of you and people just don't talk about it. So we know what happens during Ramadan. So it's an important month. But this year, we know that the fasting will start around April 13 based on moon sighting. And the big thing that is important is how long are we going to be fasting? So this year it'll be about 15 to 17 hours if we calculate the time, which is not little. If you compare to other countries, looking at 2017 data, which is still quite similar right now, where it says Ottawa, you can see that Canada is one of the longer fasting periods. So it's really important to recognize what that means to you. So our previous speaker went into the exemptions of fasting, and just going very briefly, the big things that everyone knows, travelers, obviously reasonably, as he's mentioned, children below the age of 12, those with an active sudden illness where they're quite sick, women who are pregnant, menstruating, or breastfeeding, and the list goes on. But the real question everyone asks is, where does diabetes fit into this? So scholars have actually gotten together and made very clear guidelines for us. And they've said that you should not be fasting if it makes a condition worse or delays healing. And so I'll go on and talk about what makes you a high-risk patient. And one thing I want everyone to really emphasize is one size does not fit all. Just because you heard your friend or so-and-so making their medication adjustments a certain way, or just because somebody else who has diabetes is fasting, doesn't mean that it's safe for you to fast, because your blood work is different, your body's different, and your numbers are different. And so again, you need individualized talk with your doctor. So usually if someone comes to me for the Ramadan planning, and I usually go through these topics, and I'm hoping that I can counsel you on some of the things that I go through with my patients. But ideally, you should go 1 to 3 months before. And the reason for that is sometimes you may have to be switched from one medication to another in order to be safe to fast. So the perfect patient who can fast is someone with good sugar control, so that A1C less than 7, who's otherwise healthy. Diabetes is really the main and only thing they have, and they have a low risk for hypo or low sugar glycemia. So how many people here have that? You all know if you're that case, but I do know that majority of my patients are not as well controlled. If we look at the older population and the numbers and whatnot, the risk does go high. So really emphasize and understand that you may not fit this picture right away. We know that the Canadian guidelines actually really well highlighted who is safe and who's not safe to fast. And this comes from countless numbers of people and research. And so it's very important to take this seriously. And a lot of these numbers have been actually consulted with scholars, and they've approved when it makes sense and when it doesn't make sense to fast. So the categories, you can take a picture of this, and this talk will be recorded, but I will go through in a little bit more detail. They actually come up with 3 categories. So the only category that I'm allowing my patients to fast in is in the low to moderate risk. Everyone above that, in the high risk, it says should not fast or must not fast. But for me, realistically, you're not fasting if you're at high risk or more. So what does very high risk mean? This is the absolutely you cannot fast. So if you have type 1 diabetes and your sugar control is not well, if you've had low sugars to the point of requiring hospitalization or fainting or comas, you're not going to be fasting. If you have ketoacidosis, and those with that condition know what that would be. If you have such high sugars that you've led to a hospital visit, if you're very sick at this present time, and we know that that's a reason to not fast anyways, as well as complications of diabetes. That could be severe kidney disease, neurological things, and other complications that we can discuss with patients individually. And if you're pregnant with diabetes. So ideally, pregnant patients should not be fasting. And if you have diabetes, that's an absolute no, okay? In the high risk, who should not fast, again, if you're my patient, I still don't want you fasting in this because I do see a lot of complications, especially in the emergency department, and we don't want you there. So if you have, again, mixed insulin, in general, insulin is a bit of a red flag, a certain level of kidney disease. Again, if you're performing physical labor, that's quite intense. And, our previous speaker spoke on that as well. And even if you're well controlled with type 1 diabetes, there are many reasons why type 1 diabetes puts you at much higher risk than normal, okay? The really safe, good to fast patients are the ones who are well controlled and really are on oral medications. And not all oral medications are equal, and we'll go through that. But really, the well-controlled oral medication patients, you should be safe to fast, again, after speaking to your doctor, just to make sure you're preventing any risks. So again, when I talk about medication adjustments, I want to make sure that these are just a brief overview, but your doctor should be the one to tell you exactly what to do, okay? I give this information because some doctors may not recognize that we do have these published guidelines, and they may not, think of asking you to make these adjustments, but you need to be proactive, go to them and ask them about what to do if you're on these medications. In general, these medications that you take as a pill form are safe, and that's metformin. Certain medications that go under the gliptin, they end with the word gliptin. And so these are generally the safe ones where you can continue taking it at the dose you're already on, but knowing that you take it with meals, and that would be the Iftar and Suhoor time, okay? The next class is the newer class of a lot of people are being put on Jardiance and Invokana. These are wonderful medications, but they come with a big risk for kidney damage if you don't drink enough water. And that's where fasting is so important, especially in Ramadan, because we don't consume water as well. It's not like intermittent fasting. And so if you are someone who's on these medications, you need to speak to your doctor, especially if you have kidney issues. And you definitely can't take it if you've had episodes of vomiting, diarrhea, and other things where you're losing your water volume throughout the day. Another class is the injectables that we're now getting, Ozempic, Victoza. Some of them are oral. The big thing about these are they're fairly safe to take. The only thing is if you're having, again, signs of dehydration by vomiting, diarrhea, losing fluid, then you can't be taking those. You have to hold it until you're feeling better. Again, those are already reasons for you not to fast. So that might, again, be a discussion with your doctor. Other medications that I'm not a fan of we call them the sulfonylureas, but it's the glycoside or glyburide. I know a lot of people are on those. The reason these are risky is because it basically promotes you to secrete insulin, and that means that your sugars can fall randomly. And that's, as you can imagine, a risk for someone who's not eating for 15 to 17 hours. So if you're on this medication and it's feasible to switch, you should switch. But if you're on the medication and it's not okay for you to switch, this might be a reason for you to not be fasting, okay? Again, speak to your doctor about it. Insulin, I really want to only briefly talk about it. The only really safe one would be Lantus, that nighttime insulin. Usually if you're taking more than just Lantus, it's not safe for you to be fasting. Some people take Lantus, but then take oral medications for mealtime, and that still might be okay. But if you're on any of the other insulins, I do worry. Again, this still might require a reduction in the dose, so you have to speak to your family doctor. If you're on the intermediate acting, I don't think you should be fasting, and you really need to talk to your doctor. If you're on the mealtime insulins, again, you have to talk and really adjust it based on what you're eating and the amount you're eating for suhoor and iftar. And if you're on any of the mixed ones, cannot fast, okay? Those insulins have, they have long acting and short acting together, and you can suddenly get low sugars. And so again, that's a high risk reason for not being fasting. So one of the big things that I really want to educate people on is checking blood sugar. This is absolutely mandatory if you're going to be fasting and you have a history of diabetes. Something that I often get told is, if I prick my skin, my fast will break. Well, the reality is that's not true. And scholars really do tell you that that does not invalidate the fast. Another thing that some people do is they come to me telling me, if my sugar's low, I'm going to eat something and then I'm going to break my fast. If I don't feel it, why do I need to check it? Well, you do, because you could actually harm your body significantly. It can, that beginning quote I said, if it's inhibiting healing or causing damage, which the low sugar will cause damage, you are basically harming your body, and that is discouraged in Islam, as we know. So what to do? You need to check, okay? Anytime you feel unwell, or if you're even suspicious of it, you need to check your blood sugar. Skin pricking is absolutely allowed. Low sugars can be life-threatening, and I don't want to see you in the emergency department. People go into comas, and people can actually die from that, and that's a very, very scary thing, and it's so preventable, okay? Work with your doctor to prevent it, and like the previous speaker had mentioned, we want to prevent these issues. We don't want to treat it reactionary. I don't want you to go to the emergency department, so we have to take all our necessary precautions to make sure it's safe for you to fast. So how often should you be checking your sugars? If you have type 1 diabetes, again, it is less encouraged for you to be fasting. But if you are fasting, then we want to talk about harm reduction. And that is by making sure that we're not getting into those emergencies. So you should check your sugars at least 5 times. And 2 times after the meal, so suhoor and iftar, do not skip those meals. And you should be checking it sporadically throughout the day, okay? If at any point it's low, we'll talk about what to do. Type 2 diabetes, if you're not on insulin, you really should be just checking when you're not feeling well. If you are on insulin, then it's similar to type 1, where you have to check it after meals and throughout the day. And if at any point you don't feel well, what should you do? Hopefully you all said, check your blood sugar. So when should you break the fast? I want to talk about the signs of these things. So what are some signs of dehydration? So you could feel dizzy, you might feel lightheaded, you might even faint. Some people find their heart is racing because their heart is working so hard to keep the blood pressure up, and you might be sweaty and very thirsty. If these happen, you do need to break your fast, especially if you have diabetes. Like I said, a lot of the medications you take are very sensitive, especially for the kidney, and putting two issues of dehydration and your already poorly functioning kidney together is a recipe for disaster, okay? Hypoglycemia, so low sugars. This means that at any time, if your sugar is 3.3 or less, you break your fast immediately. If it's less than 4 and you have just started the fast, or it's morning or noon, you know, there's still 5, 6, I'm going to say if there's more than 2 hours left, you can't really keep that fast, because you need to immediately keep checking it, make sure it doesn't go below that 3.3 number, okay? High sugars, this means 16.7 or more, along with the symptoms of feeling very thirsty, very hungry, and urinating excessively. Some people can have nausea, vomiting, and diarrhea from it and get quite sick. So again, if your sugars are high and you have symptoms, you need to be breaking that fast, drinking fluids, and seeing a doctor. So just to really drive this point home, what do you do if you are dehydrated? Break the fast, drink fluids, okay? Gatorade, apple juice, these are good ones because they will actually replenish some of the electrolytes as well. And don't take your oral diabetic medications that day, because chances are your kidneys are quite dehydrated and they can't handle some of the diabetic medications. And I'll go through what they are later. Low sugar, break your fast, okay? Have your little glucose tablets, honey, or apple juice are my go-to. If you have it, you have to then wait 15 minutes and then recheck your sugar. You have to keep checking until your sugar is above 4, okay? High sugars. If you are type 2 diabetic and you have high sugar without the symptoms, see a doctor, talk to a doctor. If you're type 1 diabetic, then you know what ketones are. Some people measure it at home, and if you don't measure it at home and your sugars are high, you have to go to the emergency department. If you have high or low sugars frequently, you need to really reevaluate whether you should be fasting during Ramadan. Now, this brings us to the other medications that you should hold if you feel sick. And this is not just during Ramadan, but it's during any time where you're losing a lot of water from your body. So nausea, vomiting, not eating or drinking. You have to think about the medications that really go through your kidney. And without enough fluids going through the kidney, that can really damage the kidneys in the long run. So I know these are medical terms, so I'm going to try to give some examples. So sulfonylureas are the glycoside and glyburide that I was talking about. If you are unwell, you should not be taking that. ACE inhibitors and the angiotensin inhibitors are basically your blood pressure medications. So those are the ramipril, perindopril, everything that ends with a pril, or the ones that end with artan. So candesartan, valsartan, and all of those medications. They also go through the kidney. So if you are dehydrated that day, you cannot be taking those blood pressure medications. Metformin is another one, and various water pills that you know of would be another one. I also advise against taking ibuprofen, naproxen, and anti-inflammatories like NSAIDs because they also go through the kidney, and you need to drink lots of water if you're going to be taking those. And the last one I'm saying is SGLT2 inhibitors. I know these are difficult terms, but these are your Jardians, Invokana, those new medications that I was talking about earlier, where you need to drink plenty of water. So my recommendation again for those are you take it at iftar time, drink lots of water throughout the night, and make sure your kidneys are well hydrated. So then this brings us to the non-medical part. So our diet and exercise. I won't really touch too much on diet because we have our wonderful dietitian with us today, but I'll talk a little bit about the medical aspects of the exercise and diet part. So exercise is still recommended. And what we want to really make sure that you know is that the timing and the amount of exercise is very important, and what you do itself. So during Ramadan, we usually say you can do 15 to 30 minutes of exercise. Try to keep it light to moderate. Don't do anything very intense. So I usually say resistance training. That could be Pilates, it could be some weights, it could be strength training basically, and mild cardio. If you're doing heavy cardio, that's a high risk of dehydration, okay? Make sure you're exercising in a cool place and not a warm place so that you're sweating less and losing less water as well. Exercising is best right before iftar though, because then you can basically break your fast if you're feeling unwell. So we usually say don't exercise for more than an hour around iftar time, because you're already, you spent the whole day already. And the other option is 2 to 3 hours after iftar. Again, I do understand it's late by the time 2 to 3 hours passes after iftar. So if you're doing it in the daytime, make sure you're following these guidelines. And at any point, if you don't feel well, you feel dizzy, lightheaded, heart racing, it just feels really off, you stop right away, okay? And if you really feel unwell enough to meet the other criteria, remember dehydration, low sugar, high sugar, you need to break your fast. So drink lots and lots of water between the 2 meals. In terms of our diet, I'm so glad that we have our amazing dietitian coming up next, because as much as the food is delicious during Ramadan, we really do tend to consume a lot of carbohydrates, which can damage your sugar control further, okay? So being mindful of what we eat is so important. And again, it's because of the way, we take the food, and we have to remember what we're eating with respect to what we're taking in terms of medications. So remember, during the fasting time, you have the risk of low sugars. So you have to eat things that will slowly release sugar throughout the day. And then the high sugar spikes during iftar and suhoor need to be avoided, because we need to make sure that we're not stressing our body with these sudden changes all the time. So distribute the meals evenly. Don't skip suhoor and iftar, and tune in for the next section, basically, to know what you should be eating. So in summary, the things I want to really emphasize is the importance of being medically cleared to fast. So your doctor and you should have a discussion whether it's safe for you to fast, not whether it's safe for another auntie to fast, okay? You need to know about your personal risks, your safety risks, and what to do when you have these episodes of feeling unwell. And know when to break your fast. Allah knows everyone's intentions. No one wants to just break it. But when you have to break it, you have to break it. And your body is an amana from Allah subhanahu wa ta'ala. So make sure you take care of it by also breaking the fast, because that is what's better for you at that time. And try to know about the sick day medication list. I know I went through it more verbally. If you ask any doctor what they are, they will go through what you're taking and which ones apply. So at any point of dehydration, at any time of the year, even if you're not fasting, you should know which medications should be stopped when you're sick. And with that, I will pass on the mic to our next speaker.
Jazakallah khair, Dr. Nasreen, for sharing all this valuable information. Inshallah, we'll have a combined Q&A session with you after Sister Nazima's talk. Thanks again. So our last speaker for this evening is Sister Nazima Qureshi. Nazima Qureshi is a registered dietitian and nutritionist with a Master's of Public Health. She is the co-founder of thehealthymuslims.com, which is dedicated to helping Muslims make healthy eating and fitness the easy choice. She provides evidence-based and practical online programs to clients worldwide. She hosts in-person and online events and provides culturally relevant tips to make lifestyle changes. She is the co-author of The Healthy Ramadan Guide, a complete meal plan and fitness program, as well as an informational guide to help the community have the healthiest Ramadan yet. I'll now pass it on to Sister Nazima.
Jazakallah khair, Sister Nabiha. Thank you so much for putting together this presentation. I find it's really important for us to talk about this as a community. I will start off with a personal experience that I had. When I was 14 years old, my dad was diagnosed with type 2 diabetes. And I remember that, the first couple of years, he was almost, a little bit concerned to fast. And then he started fasting as well. But one thing that he would do is not go to the doctors during around Ramadan time, because he felt like the doctors would just tell him not to fast. So alhamdulillah, he was able to manage and figure out how to fast in a healthy way. But I think, there is a lot of dangers when it comes to trying to fast on your own and not really know, what are the kind of dangers and when you should be breaking your fast. So Thank you so much to Dr. Tanzila, who kind of went through, especially when you should be breaking your fast, right? That is probably the most important thing, is being able to identify. And so usually I recommend, that you should be speaking to your doctor at least a month in advance and start, determining if, number one, your blood sugar levels are, at a good kind of normal range, you're able to manage them really well, in order to be able to safely fast. If you're at this point, and right now we're just, less than a week away, or less than 2 weeks away from Ramadan, and, if you're at the point where you have a lot of low blood sugar levels, right? You have a lot of high blood sugar levels. You haven't spoken to your doctor about how to kind of manage your medication, and if you're able to move your medications schedule in a safe way, or there's going to be any sort of side effect on your health, then fasting may not be the best option. And really, the purpose of our presentation today with all three of the speakers here is not to say that, if you have diabetes, you have to fast. No, that's not what we're here for. Really, we're here to help you safely fast. So number one, if any of these are a concern, then fasting is not necessarily the best option for you. However, if you're able to manage your blood sugar levels well, and you should have been doing that in the past month or so, then you may be able to fast in Ramadan. However, even with you managing your blood sugar levels well, knowing when to break your fast, and like Dr. Tanzila went through, what are the signs of having low blood sugar level, you should be able to identify and know when you need to break your fast, because that's probably the most important thing. So with that being said, I'm going to go through some guidelines in terms of how to make healthier choices. And while, we are talking about people that are living with type 2 diabetes, this, by far can be applied to the general audience as well. I always say that, especially in the South Asian community, we're at high risk of developing type 2 diabetes. So I always say, we should eat in a way that helps, decrease that risk. Especially, one is our ethnicity, but also if we have a parent or grandparent, it increases our risk of developing type 2 diabetes. So we do want to eat in a way in which we're managing our blood sugar levels, even for a healthy person as well. And then particularly if you already do have type 2 diabetes, we want to make sure that you're managing so that throughout the month you're not having any episodes of extremely high or extremely low blood sugar levels. So of course, when it comes to fasting, we have really the two main opportunities to fast. And so with Ramadan, I always kind of reflect on what really is kind of the essence of Ramadan. And while we do say it's the month of fasting, I find, especially in our community, it quickly becomes the month of feasting. And so when that happens, we end up consuming a lot of foods that are not necessarily the best for us, for even the average person, but especially if you have a health condition, it can have a significant impact, right? And we're not even talking about long term. We're literally talking about the same day you can see significant negative impact. So we really want to kind of reflect. A lot of times people feel like, I don't want to be on a diet. I want to enjoy my food. And so that's actually one of the reasons why we published the Healthy Ramadan Guide, as mentioned before. So this is a physical book. And so we put together the scientific evidence, but also the cultural aspect. So incorporated foods and recipes that you'll actually enjoy, and you don't feel like you're actually, eating diet food or food that you feel like you're being restricted. So when it comes to suhoor, of course, number one, I will say, especially the first few days, it's a little bit awkward kind of waking up in the middle of the night and eating a meal. And so number one, make sure that you are waking up for suhoor and having a proper meal. This is your last opportunity to nourish yourself. So just having a sip of water or sleeping through suhoor is definitely not an option, especially if you have type 2 diabetes, right? This is your last option to kind of make sure you're giving the body the nutrients it needs so that you have more maintained, managed blood sugar levels throughout the day. So you have to be waking up for suhoor. If this is something you're not able to do, I know some people say they just can't eat at suhoor time, then, it probably isn't the best idea for you to be able to fast. So now, when it comes to suhoor, what you eat is just as important as waking up. And this is not about being able to eat as much as you can in a short period of time to, so you don't feel hungry throughout the day. It's really about being mindful in terms of what are the key items you're consuming. And I find the very common thing that, most people have is some sort of carbohydrate, something simple. So like a bowl of cereal, or, some toast, something quick. However, these are probably one of the worst things that you can have, not only for someone with type 2 diabetes, but even for an average person. And the reason for this is because these are very simple carbohydrates. So some people may say, you know what, I don't have any sugary cereal. I'll just have a bowl of like cornflakes or something that's not sugary, but plain. However, it digests really fast. So what's happening is your blood sugar levels will spike, and they'll likely come down just as fast as well. And so this is where you're going to see blood sugar levels that are not maintained over a long period of time. So we definitely want to avoid that. So what we want to do is instead replace those simple carbohydrates with more whole grain carbohydrates. One of my favorite, whole grain carbohydrate is oats for Ramadan. Lots of great fiber. There's a lot of research showing that it actually helps, manage your cholesterol levels as well. But because it has a lot of fiber, it helps kind of maintain your blood sugar level. So it's not going to spike it as much. Now, when you have these whole grain carbohydrates, other options, if you're doing like a whole grain sprouted bread, if you're making your own kind of flatbread or roti at home, using multi-grain flours is another great option. We basically want to kind of increase the fiber. Now, we want to pair it with a protein and a healthy fat. Okay, so the protein and healthy fat is also going to help slow down the release of those blood sugar levels into your bloodstream. And so examples of protein, if you're having breakfast type foods, would be things like your eggs and Greek yogurt. If you're having dinner type foods, it would be like your chicken, your fish, your meat. Plant-based proteins are a good option as well, but keep in mind that things like lentils, beans, while they have protein, they also have carbohydrates in them. So that's where you have to kind of manage a little bit. So if you have, say, a plate of rice and dal, you can easily kind of go over your carbohydrate amount because you're getting the carbohydrates from your rice and then you're getting them from the dal or lentils as well. So that's something to keep in mind. And then what I always recommend is try to have some sort of vegetable and a low glycemic fruit. So with vegetables, I find this is probably the area where everyone kind of skips out on is there's not enough vegetables. And when I'm talking about vegetables, I'm not talking about potatoes. I'm talking about kind of the colorful ones. Go for broccoli, mushrooms. Think about different colors. A common question I always get asked are, what are the vitamins I should be purchasing for, good health? And I always say, and at the flip side, I always hear people saying that, they find eating healthy quite expensive. So I always say, if you have a budget, whether it's $20 or $100 in the month, instead of spending it on those supplements, always start with food first. So you want to be purchasing, a variety of colors of vegetables. And so instead of purchasing the same 2-3 vegetables every single week, change it up. So if, this week you're picking up eggplants and okra, then next week you're picking up broccoli and cauliflower. So different colors will mean your body is getting different nutrients. And the added bonus there is there's no carbohydrates in these vegetables. So you can actually have more and fill up your plate on these vegetables and get those nutrients without having a negative impact on your blood sugar levels as well. When it comes to fruit, so you don't have to fear fruit in the sense that, oh, this is going to be bad for me too. But there are certain fruits that are lower in the glycemic index. So what that means is when you have, say, 1 cup of that fruit, certain fruits will increase your blood sugar levels a little easier while other ones won't. And so things like strawberries is probably the lowest glycemic index fruit. And so that's something that you can incorporate at your suhoor time. And then lastly, water as well. And so when it comes to water, what I usually recommend, and it's actually a great point that Dr. Tanzila mentioned that, we want to make sure that especially with medication, you want to make sure you're staying hydrated. So what I usually recommend is you want to be having the same amount of water in your fasting day as you would in your non-fasting day. And at first it may seem, well, how can I drink the same amount of water? So say your goal is about 2 liters. This is an average amount. So ideally at suhoor time, you want to have anywhere from 500 ml to 1 liter of water. And of course, the first couple of days, it's a little difficult to drink that amount of water, but I find few days in, you get quite comfortable. And so in terms of, you don't have to, measure every single time, but if you have like a big glass at home, usually 2 of those glasses are 1 liter. So one glass is usually about 500 ml or 16 ounces. So 2 of those glasses will be your 1 liter. And then you want to be drinking the rest of the amount from iftar to bedtime. And so these are kind of the main components when it comes to suhoor. And I don't want you to feel like you have to have this huge feast, because now I just told you, okay, you have to have all of these things. And so one thing I've done, we've done in the Healthy Ramadan Guide is incorporated recipes that include all of these components, but it's not complicated. So this is probably one of our favorite ones, which is our overnight oats. And so this is something you can make ahead of time. We have some recipes here if you're more of a savory person, you like eggs. So this is like a savory oatmeal. We have a variety of recipes in here as well. And so the great thing with this is there's also information on the carbohydrates for every single recipe. So if you're, say, if you have type 1 diabetes and you have to do carb counting, it's going to be listed there for every single recipe as well. So now that we've had, our healthy suhoor, and once again, I will say with this Healthy Ramadan Guide, we made this for the general population, but this is also, diabetes friendly as well. Because like I said, whenever I think about, how we should be eating, I always think about, okay, preventing type 2 diabetes and a lot of health issues as well. So this is something that's really family friendly. This is not a diet book. This is a book that will help you eat healthier in a lifestyle way. So in a way that, beyond Ramadan, we have people last year, mashallah, we reached over 1,000 people in 30 different countries. And so people from different, ethnicities and backgrounds enjoyed the food, but then they also said, after Ramadan, we still made these recipes, which was great. And then next will be our iftar. So I find it's a lot easier to implement a lot of the suhoor kind of tips that I've said, whereas iftar, it could get a little bit more complicated. And the reason for this is because, like suhoor time, we're waking up in the middle of the night, you're kind of on your own. You can just kind of eat whatever you want. However, iftar, there is this huge social aspect to it, right? And it does seem like we're going to have another kind of COVID lockdown Ramadan. However, even at home within our families, right, we have traditions and we want to enjoy our food. And so I kind of want to provide you with some guidance in terms of how we can shift that. Number one is going into our mindset, right? What I mentioned earlier was, what is the purpose of our fast? And so we're going, 15 to 17 hours fasting. And is the purpose of Ramadan really to overeat every single day for 30 days? Like, is that really the essence of Ramadan? So I always say, think about your mindset going into it. A lot of times we feel like we've earned this meal, I should eat whatever I want because I've been fasting for this many hours. But I think it's really about, reflecting on what is this essence. Alhamdulillah, every single night we have these beautiful spreads of food. So we don't have a shortage of food. So we don't need to consume in a way that, we're not going to get food the next day. Like, alhamdulillah, we have that. So taking a moment to first reflect on how we're consuming at iftar time, and if it's really in the essence of kind of our goals and our intentions, and the spiritual aspect. Also, when it comes to nutrition and even fitness, people always think of it as a very superficial thing. And I don't think I mentioned this, but so I have co-authored this book with my husband, Bilal Hafiz. So he's a personal trainer. And so when we think about fitness and nutrition, it's, yeah, sure, a lot of people want to lose weight, but there's also this connection, that spiritual connection. So what is the purpose of eating healthier in Ramadan? And what is the purpose of being able to be active? Essentially, it's to be able to have enough energy so that you can do more ibadah, right? And especially for someone who has a health condition, it's to be able to manage and stay as healthy as you can so that you can continue throughout your Ramadan. And essentially, even outside of Ramadan, being able to be a stronger and healthier Muslim as well. So going to our iftar. So what I find is, we're all kind of sitting at the table waiting for iftar, waiting for Maghrib to kind of strike. And so you start smelling the smells and you start getting hungry, not even with your stomach anymore, with your eyes, with your nose. You're starting to get to this like extreme hunger point. And so the second it becomes Maghrib time, we end up consuming an insane amount of food. So it's usually a lot of fried items, right? Lots of cultural items, fried items, heavy items. So within 5 minutes, we'll end up eating so much food, we don't even realize how much we've eaten. And so the problem with this is that it actually takes about 15 to 20 minutes for your body to start registering that you're starting to like get full. So if you've ever, I hear this a lot with a lot of people where they'll say, the whole day throughout my fast, I'm doing really well. But after Maghrib, after Iftar time, I can't move, like I'm exhausted. And the reason for this is because you're essentially overeating. You're eating at a faster pace than what your body is able to kind of signal. And then you're finding out like 30 minutes later that, whoa, I've actually overeaten, and you start getting these uncomfortable feelings as well. So that's something that we definitely want to avoid. And so in order to kind of be more in tune with our bodies, and this also makes me reflect on the hadith. The Prophet ﷺ said that we should be eating, 1/3 air, 1/3 food, and 1/3 water. And so I have had this question where it's like, well, how do I know how much is 1/3 of food for my stomach, right? I always get this question. And so when I reflect on that, I think, okay, it's about kind of being more mindful in terms of how we're consuming and slowing down the pace. Right. And so if you think about the scientific side, where it takes 15 to 20 minutes for your body to catch up and be like, hey, I'm getting full, it's a sign that we should be slowing down how we're eating as quickly as you can within 5 minutes, and then finding out 30 minutes later that you're full and you've eaten past your capacity. You've eaten more than the 1/3 fill. So in order to do that, this is what I recommend. So when you're breaking your fast, you're going to have one date. So usually, okay, with the dates, you have Majdool dates, and you have, like, say, Ajwa date is like this small. So if you have type 2 diabetes, a Majdool date, probably just one. If you have an Ajwa, you can probably get away with 2, but just be mindful that you're not over consuming the dates. The dates in themselves, the sugar is not bad for you, but if you over consume, if you have 5 to 10, then you may see an impact on your blood sugar levels. So I would say have 1 if you're having a big date, or maybe 2 if you're having a smaller date. Have a glass of water, so big glass of water, 500 ml, and then you can do a small bowl of fruit. So once again, go for lower glycemic, higher water content. So your strawberries, your berries, your melons. And now the most difficult thing is go and pray your Maghrib Salah. Don't eat anything else. Go pray your Maghrib Salah. In that time, your body is getting the natural sugars, and then time it takes you to pray, 10, 15 minutes to pray your Maghrib Salah. You'll find when you go back to that dinner table, you're not extremely hungry. You're still hungry, but you're able to kind of eat in a more calm way, right? You're not going to overconsume. And now when you are going back to the table, I do want you to enjoy your cultural foods, but I will kind of give you guidelines in terms of what you want on your plate. So usually at home, we kind of have buffet style, right? So we'll have different things at the table. And so what I say is make your plate before you start eating, rather than taking a little bit of this and then you eat and a little bit of that, and you don't know how much you're actually consuming. So make your plate, 1/4 plate protein, 1/4 plate carbohydrates, and 1/2 a plate of vegetables, okay? And so usually there's always some sort of protein, our chicken, our fish, our meat, our lentils, and there's always carbohydrates, right? Our rice, our flatbreads. There's never a shortage of that, but it's usually the vegetables that it's missing. So this can be in a salad form or cooked form, as long as it's not overcooked, and if it's not like deep fried, too much fat. You want to be able to be able to see the color and that brightness in those vegetables as well. So 1/2 a plate, and I find when you kind of slow down your eating, you will be satisfied in this amount of food, right? And you yourself will find you have a lot more energy. You're not feeling that sudden like uncomfortableness, and inshallah your blood sugar levels will also be maintained at a much better pace. And so a lot of times people like wonder, like, where do fried foods fit into this? So what I do say is, if you follow me on social media, you'll see every year I share this graphic. But basically, if you were to have 3 samosas every single day, and I'm giving samosas as an example because this is really, this is really something that everyone has at their Ramadan table, samosas, but you can replace this with your spring rolls or whatever. So 3 every single day for 30 days. Just 3, you would have easily gone to close to 100 samosas at the end of the month. But let's be honest, we don't just have 3, we have the samosas and the spring rolls and all sorts of things. So we're consuming hundreds of fried items within just 1 month. We don't consume that much fried food in any time of the year, but yet we do that in Ramadan. So what I say is, there's a few. One is you definitely can bake or air fry your items, but even with that, be mindful because it's still carbohydrates, right? It's still wrapped in the pastry, which is carbohydrates. But what I say is either you can do 1 a day, 1 fried item a day, so 1 samosa or 1 spring roll. At the end of the month, you still would have had your 30 samosas or spring rolls, right? Or you can do On the weekends, you can have maybe 2 or 3, right? So you can just kind of stick to the weekends. Something we do in our household, and we don't have any health conditions, but we focus on kind of that energy aspect and how we feel. And we find, I grew up with all of these cultural foods and traditions, and I found, while it tastes good to have these fried foods for a few minutes, afterwards, how you feel after is just not worth it. And so we actually stay fried food free throughout the month, and we'll indulge and enjoy ourselves on Eid day itself. And we find it has a very positive effect on our energy levels as well. So on that note, I will wrap up. The last thing I will say is just keep in mind also the evening, your evening time. So especially if you're staying up later, you may want to incorporate a small snack there. So in the Healthy Ramadan Guide, there's also snacks, whether you have like sweet cravings, there are a lot of snacks there. And also if you're not purchasing this book, another great option is on our website, we have a Ramadan section. So you can go to thehealthymuslims.com/Ramadan. Okay. And you will see there's recipes there. There's resources there. If anyone is like nursing or has digestive issues, we go through everything in detail. If you see something there that, is not addressed and you have a question, you can send us an email. Inshallah, we can address it through the article. So there's also, this is not just, like I mentioned, it's not just recipes. This is you get a full meal plan. At the back, you also get a full workout program that you can do at home. And also if you're not, there's even a mobility workout. So if you're getting aches and pains throughout Ramadan because you're praying a lot more or you're not as active, there's a daily 5-minute mobility routine as well. So this is a great option that kind of maps out everything when it comes to Ramadan. You don't have to worry about, okay, what should I make today? Is it going to be healthy enough? So this kind of really provides you with that information. So I will wrap up my part of the presentation. Inshallah, we can open it up for questions.
Jazakallah khair, Sister Nazima, for the wonderful advice. I'm sure these tips will be beneficial in Ramadan and even afterwards for all of us, inshallah. So we will conclude our talk today with a question and answer session with Dr. Basreen and Sister Nazima. The first question is for Dr. Basreen. If I am taking glycoside 30 milligrams and Ramapril 5 milligrams once per day, can they be skipped temporarily during Ramadan? My HbA1c is less than 7.
Okay, so I want to start by saying that this talk cannot replace a true appointment with your family doctor. The reason being is I know you're giving me some good numbers and information, but I don't know a lot more about your background, your other medical conditions, and everything. The one thing I will say is avoid the idea of just skipping a medication. Remember that your A1C is less than 7 because you are taking that medication. That medication is helping you keep it at bay. So if you're going to skip it, we need to talk about what to replace it with, okay? So is that going to be some sort of a diet change, major change? And do you have room for that? Unless it's genetic, diet won't really necessarily change that. If you're not taking the glycoside, what's going to happen to your sugars is going to spike, right? So that's another complication. So again, a conversation with the doctor is important. Now, one thing I could suggest is Ramapril you can take. So take them with Iftar, just drink lots of water at night, okay? Now, glycoside, if you're only taking it once a day, then take it maybe with Iftar because you're going to reach Suhoor, and make sure you don't skip Suhoor, okay? So if during the night you have any tendency of getting low sugars, you will cover it with Suhoor time. So that's the only advice I give you. But again, this doesn't replace true medical consultation because I don't know your blood work. I don't know your other factors. And whenever you think of skipping something for anyone, remember it's going to have an adverse effect unless you replace it and compensate for it somehow.
Okay, thank you so much, Dr. Basreen. Our next question is for Sister Nazima. What can I eat to maintain my energy levels during Ramadan while I'm fasting?
So I guess pretty much the presentation I went through, making sure you're having the components. Biggest thing is the right amount of protein, the fiber, and the healthy fats. So at Suhoor, at Iftar, And also keep in mind, there's not one food, there's no like one superfood that's going to provide you with energy, right? People love just wanting to know, okay, give me the one food. There is no one food. It's about the pattern of eating. And that's what's going to give you a sustained amount of energy. So are you having the right suhoor? Are you having the right iftar? Are you not overeating? And then also making sure you're staying hydrated throughout it. So just kind of, incorporating the tips that I mentioned throughout the presentation, but also just realizing that it's not just about one day, but keeping it consistent. And then inshallah, also maintaining these healthy habits after and before Ramadan as well.
Thank you so much, Sister Nazima. We do have another specific question. It goes as follows. My son is pre-diabetic. Last year, he could fast during the lockdown, but this year he will be at school. Would you advise him to fast or not? How can I be sure that everything goes well for him?
So again, I want to start by saying, I can't replace true medical advice, but anyone, not necessarily 13 or not, anyone who has pre-diabetes and they're what we call diet controlled are usually safe to fast. Okay, you're not in the high risk category, and if at all, sometimes they're only taking metformin, and that's usually safe to fast with no known complications, unless of course there's other medical conditions. And so again, I don't know that piece. In terms of going to school and fasting, I think that is safe, just like it's safe for anybody else. Obviously, if someone is doing something very extraneous, like sports and things like that, it should be okay. We've all gone through school and exams. I've had 24-hour call shifts fasting, and for the most part, subhanAllah, Allah has made our body capable of fasting through that. But I will say, I don't know the blood work and I don't know the other existing factors, so that is still a discussion with the family doctor. But anyone with pre-diabetes, either diet controlled or only with metformin, is in the safe category.
Thank you very much for that, Dr. Basreen. We have another question for Sister Nazima. Do I need to count calories while I fast to control my sugars? What carbs should I advise? So there's two questions in there for you.
So when it comes to calories, whether you have type 2 diabetes or even the average person, calories does not give you the full picture, right? So a lot of times people will like download an app and look at calories. And while it may give you, a lot of times people do it for weight loss goals, it may give you kind of short-term weight loss. It's not giving you the full picture. So let me give you an example. Like if you have, you want to consume, say, 200 calories, and there's a salad in front of you and a bag of chips, and they're both 200 calories. And so if you're only focusing on calories, a lot of times people say, well, let me just eat the chips. Like what's the difference? And so now when you kind of relate it back to, let's say specifically for someone who has type 2 diabetes, the impact on the blood sugar levels that the chips will have is a lot different than, say, the salad. Now, for an average healthy person, same thing, right? The impact on health of the bag of chips versus the salad is significantly different. So I actually never count calories with my clients. Even if they have weight loss goals, I always focus on portion control and focus on incorporating the right types of foods. And then there was a second question, sorry. Which carbs should I avoid? So when it comes to carbohydrates, you want to have more complex carbohydrates. So you want to avoid white carbohydrates in terms of like white bread, instead have more whole grain carbohydrates. Also think about any sort of processed white carbohydrates, right? So your chips and crackers and even a lot of granola bars are marketed as healthy, but they will increase your blood sugar levels really quickly. So instead you want to have more whole grain carbohydrates, but also the portion is just as important. So if you're having, like, say you've switched over to brown rice, but then you're having like 2 plates full of brown rice and you're saying, well, why is my blood sugar level increasing, right? It's the amount as well. So being mindful of the quality, but then also the quantity of your carbohydrates is important.
Perfect. And just going off of that, we have another follow-up question about things to include in our diet. Is paneer a good or healthy option to include in your Ramadan meals?
So it depends on like how you're consuming it, right? So if you're consuming the right portion as the main protein, and then you're serving it with vegetables and your carbohydrates, then it's fine. However, if you're doing something like if I say yes and you go and deep fry your paneer, it's probably not, or batter it, it's probably not a healthy option. So as long as it's part of like a healthy meal, then you should be okay. One thing to keep in mind with paneer, that the saturated fat is a little higher. So for someone who may have, cardiovascular, like high blood pressure or cholesterol, something like paneer regularly may not be the best option. But I'm just saying, in terms of like the average, actually in our Healthy Ramadan guide, we do have like a palak paneer, like a healthier option. So you can definitely incorporate it. It's how you have it as well.
Thank you very much. Again, just related to the carbs, we do have another question. You advised eating strawberries for suhoor. Could you please mention a few other good fruits and few fruits to be avoided during Ramadan?
Okay, so this, if you have type 2 diabetes, once again, you have to just be mindful of the quantity. So you can incorporate a variety of fruit. Certain low glycemic, so berries are low glycemic. I think apples and pears are also lower glycemic, but once again, the quantity is important. So as long as you're having a small quantity, so you can see the effect it has on your blood sugar levels. So you can start off with, say, half a cup and see what the impact it's having. Once again, also pairing it with protein and healthy fats will help slow it down. So when I say having like strawberries at suhoor, like have it with some oats, right? And then incorporate some sort of healthy fat, and that will overall not increase your blood sugar levels. For the average, average population, if anyone is watching, they don't have type 2 diabetes, you don't have to be you don't have to fear fruit. Fruit is not bad for you. Even for someone with type 2 diabetes, fruit is not bad. You just have to be mindful of how much you're consuming. For someone with type 2 diabetes, and for someone who's healthy, I never hear anyone with health conditions because they consume too much fruit. It's usually the sugar that you're having in the processed foods, the added sugar, that is the real concern.
Thank you, Sister Nazima. Our next question is for Dr. Tanzila. Salam. I feel nauseous if eating very early in the morning. I rarely eat breakfast anymore. Last year, I started skipping suhoor and just drank about 1 liter of water at a time. I felt much better than the year before when I ate food during suhoor. Is this okay?
Okay, so again, I don't know what other medications you're taking and all of that, but I will say, people who tend to get low sugars, they need to be eating suhoor. And eating suhoor with those foods that are not processed sugars, but things that will last throughout the day, even if it's a little bit, I think you should have it. Again, it depends. Are you taking a medication during suhoor? So if you're taking a metformin at iftar and a metformin in the morning, water will not cut it for you and you will feel nauseous. Now, I know you're saying that you feel the reverse. I think this is a discussion you might have to have one-on-one to know what medications you're taking. But if you are taking medications, I know that the research shows you should be eating something. And that something can be, if it's oatmeal, if it's something that's not too sugary, but kind of a balance, like Sister Nazima was saying, but you should be having something or another.
Okay, thank you. And just to follow up on that, if my sugar goes low while I'm fasting, what's the best thing to do to increase my sugar levels so I don't get dizzy?
So, make sure you rewatch the part where I talked about it. So if your sugar's low, so if it's less than 4, you need to be potentially breaking that fast. If it's less than 3 if it's 3.3 or less, you have to break it. Okay. So if it's less than 4 and you feel unwell, or whether you feel unwell and it's not even less, you need to break your fast, because diabetes is one of those things can progress very quickly. I personally had an experience. I was in the mosque 2 years ago, which started all my research into this actually. In the mosque, and there was a woman who fainted, and it turned out she was on metformin. She wasn't, she pushed herself for the last 2 hours, and she had very low sugar, and she fainted. She could have hit her head, had a brain bleed. She could have had a coma and gone to the emergency, and that would be the end of it. Again, if you feel unwell, you have to break your fast, okay? Whether it's dizziness, whether it's low sugar, even if your sugar is normal and you feel really unwell, that's enough grounds for a patient with diabetes specifically. We're not talking about the regular population. You have to break your fast, okay? Now, what do? Honey, a spoon of honey is okay. A glucose tablet is okay. or apple juice is another one. Okay, so these are the ones that I usually say to break it with. I know a lot of people say dates, and you could, but it's not as fast. Okay, so you really need to remember those, and you need to check your sugar 15 minutes after that to make sure your sugar is now above 4. If it's still less than 4, you have to keep doing that every 15 minutes until it's up above 4.
Thank you very much. Sister Nazima, we have another question for you. Is it true that we should completely avoid any kind of fruit juice or milkshake during Iftar for the fear of a spike in blood sugars?
Yeah, so when it comes to juices, and a lot of times, even if you're juicing, so if you, I'm assuming you mean like just like purchasing a juice from the store, but even if you're juicing at home, a lot of the fiber is gone. So if you have a juicer and you're making, say, your own apple juice, a lot of the fiber is gone. So I always say it's better to consume the fruit over the juice option. And the reason for this, and even in the most natural form, the fruit will have more fiber. Now, when you're looking at a juice that has added sugar, this can increase your blood sugar levels really quickly. And like Dr. Tanzila just gave an example that, you know, one of the best things, you can just have apple juice if you're having low blood sugar levels, and you'll see within 15 minutes your blood sugar level increases. So for someone who, you know, you're having regular blood sugar levels, if you're consuming your juices, it will increase your blood sugar levels very quickly, and you're likely having it with other foods, so probably not the best option. I usually just say to avoid any sort of juices and instead consume the fruit. Same with milkshakes. Like, you can do smoothies that have like fruits and veggies and protein that's more kind of wholesome, but a milkshake that I'm assuming probably has sugar, maybe ice cream, probably not the best option. It will likely increase your blood sugar levels.
Thank you, Sister Nazima. Our next question is for Dr. Basreen. Is it recommended to donate blood while fasting, or is it okay to donate blood while fasting?
Okay, so I can't speak on the fiqh of it, but from what I know, Islamically, you should not be donating blood while fasting unless it's an absolute necessity. And I think that's an important concept because, you know, it is, you have to kind of judge how important it is for you. And I absolutely commend anyone who is donating blood because we absolutely need it, but try to time it on times where you're not fasting, okay? We know that people with low iron should not be donating blood. Why? Because you get lightheaded, you get dizzy. If you're already dehydrated and you're removing against that, remember I was talking about the volume of fluid in your body, if you're removing that, then you're going to be, again, dizzy and lightheaded, and you're going to be breaking your fast. Now, I don't know if this person asking has diabetes. You absolutely cannot in that case. But even if you don't have diabetes, you should not be donating blood, okay? There's a time and place for everything, and I think making yourself at higher risk of needing to break your fast by donating at that time is not recommended, at least medically, in my opinion. And I believe that is also the Islamic view as well.
Thank you, Dr. Basreen. Our last question is for Sister Nazima. We talked a lot about your Ramadan book. Do you have an online version available for purchase?
So this is, we only offer a physical copy. However, we do offer worldwide shipping. So this can be shipped anywhere in the world. Right now we have free shipping across US and Canada, and flat rate shipping across the world as well. So you can order this. And yeah, so we just do physical. And the reason for this is because we found, I've done like e versions in the past, and there's just something different about having a physical copy. And actually last year we launched this during like the first COVID Ramadan. And it was so nice to hear families like kind of sitting around, you know, at iftar time, using the book physically to actually prepare the meals, or using them to do the workout. So it's actually been really nice to have the physical form. So right now we don't have the e-version.
Great, thank you so much. Those are all the questions that we have for today. And
I want to add a little bit. I don't know if I can share my screen quickly about something about diet. All right. I can do that, right?
Yeah, for sure.
Okay, perfect. So something that I like to show everyone, and I know Nazima went through this, is like a visual of the Ramadan plate method. So I don't know how many of you have had this talk with your doctors about the plate method in general. It helps, a lot of you are asking about calories and things like that, but it really helps to visualize your plate. So in your mind, you should have, my plate is my plate and I'm not exceeding it, okay? And in your mind, you should have half that plate is vegetables, a quarter protein, and only a quarter carbs. So when you're talking about those fruits, when you're talking about the dates, when you're talking about all those things that come to your mind, you have to fit it in that quarter, okay? Maybe dates can be an exception because it's so special. And even with dates, we say you have to limit it to one or two because it has a lot of sugar, but it's a good sugar. So again, you have to balance that. But the best and easiest way to visually plan your meal, and I say this for anyone who's watching who doesn't even have diabetes, the healthiest meal is when a half of your plate is vegetables, a quarter is protein, and a quarter is carb. If you follow that, you will either lose weight, you will feel more energized, and you will be healthier in the long run, okay? So that's one important thing. And I think I saw one question about calories, and I agree with Nazima, I'm not a big fan of calorie counting, but there is evidence to show that you can lose weight during Ramadan if you eat carefully, okay? You can take a picture of this or screenshot it or whatever you may will. But basically, based on your height, there are certain calorie amounts that you could, if you wanted to go through that approach, calculate and make sure that you're actually losing weight. Again, this could mean that your medications need to be adjusted, speak to your doctor, but it is there, and this comes from the diabetes guidelines made in the Middle East. So just another thought on why Allah has prescribed fasting for us. Again, if it's safe for you, there are lots of benefits to it.
Thank you so much, Dr. Bisreen and Sister Nazima, for the wonderful presentation today. This is the end of our seminar, and we hope that the seminar was beneficial to all our audience and to their loved ones as well. A recording of this talk will be posted on social media, so please feel free to spread the word to your friends and family. Before we leave, I would like to let you know about an upcoming event by the MMAC. I'll just share my screen.
Sorry, I think we just lost Sister Nabiha. Just give it a second and I'll be back.
My apologies, I think my computer just crashed. Before we leave, I just wanted to let you know about an upcoming event the MMAC is hosting in collaboration with Yaqeen Institute and Sheikh Dr. Omar Sulaiman. You can find the flyer on our social media, but in this virtual event, Dr. Sulaiman will address Ramadan's role in helping frontline healthcare workers to continue their efforts in the face of the difficult circumstances of the COVID-19 pandemic. The event will be on April 17th at 2 p.m. Eastern Standard Time. All proceeds from this event will go to supporting MMAC's volunteer programs, and tickets will be available on mmac.yapcity.com. That being said, I pray that we all have a blessed and healthy Ramadan this year, inshallah. Jazakallah khair to all of you once again for joining us today. Assalamu alaikum.